Hey guys, happy Sunday. It's August 23rd. We're going to talk about cancer terms so we can have an understanding. I had a lot of learning to do on my own. So let's start with when I had my first screenings with the mammogram and the ultrasound. Those are called your BI-RAD scores. Your MRI will have one, your ultrasound, your biopsy. Those BI-RAD scores are 1 through 6. One being nothing, two being pretty much nothing, three being nothing, and then four something suspicious, five biopsy, we need to do that, and then six, that's your prognosis, like you have cancer. So that's the first step. Then they recommend that you have a BRCA test. So that means that you get blood work done, and it's based on like your genealogy. Like, do you have the BRCA genes? And there's several different variations of the BRCA gene. You have colon, you have breast, you have prostate if you're a man, well, male or female, I guess. Just different variations. Um, so with me being positive for cancer, I have what they call invasive lobular carcinoma. It's cancer of the breast, which forms in the milk duct. It is estrogen fed. So, one of the other things in the report, there's ER positive and ER negative. I am ER positive, which means I'm estrogen prone cancer. The ER negative is a whole different level, which I'll get into. So, ER negative. I'm sorry, ER positive. And I'm positive, I thought he said 2, which makes me 50% of the cells that they extracted from the biopsy were from estrogen. That's what I know. Also, it's 1.3 centimeters, which is stage 1 going on 2, a very slow grower. So I have 2 positive check boxes. So slow grower, estrogen. Now, if it would have been ER negative, apparently that's a bad thing, which I'm not. Positive, it's estrogen fueled. And then you have the HER protein. I'm HER positive. If I would have been HER negative, that's when cancer is not estrogen. It's actually something from the BRCA gene that's inherited and can be very aggressive. So I did have the BRCA gene test done. I do not know what those results are yet. That will probably be within like later August, 1st of September. I'll know those results before I go to my breast surgeon, which is September 16th. I went to an oncologist consultation. He pretty much said that my cancer is going to be treated with hormone therapy after the surgeon removes the lymphs, probably, which I'm sure she will, because there's still questions on those lymphs because it came back benign. And according to this last oncologist, when he read the report, it said that they missed the tissue. So we really still are inconclusive on those lymphs. Or there's one that was suspicious, so they don't know. So we'll figure it out. Hopefully just grab them and they go in and take the tumor that's in my breast. Do it. The BRCA test. My aunts, all the ones that had cancer, had it done. they all tested negative for it. So that means it's not a hereditary thing. It's an estrogen fueled cancer, which probably runs in my family. We have all had high estrogen issues. My mom had endometriosis. I had endometriosis. A few of my aunts, my cousins. It's in my family. Infertility runs in my family. Um, there are a few cousins of mine that don't have children. I don't have kids because of it. I did have a laparoscopic surgery when I was like 38, which ruled that I had stage 4 endometriosis, which really just like destroyed like my female organ, like my female reproductive organs. He said that he couldn't even flush water. Dr. Nash out of Akron, he said he couldn't flush water through my fallopian tubes. Like it was just a done deal. Like nothing could even happen. I did have some anomalies in my ovaries, which he had to remove. They were cysts. They were called ganglion. Yeah, I'm misspeaking. I don't remember, but they were gross. They had like hair and teeth growing out of them. Kind of weird. So, somebody, somebody wanted to say hi. That's Sadie. She's 13. Anyways, so BI-RADS score 1 through 6 for MRIs, ultrasounds. So if you're a 4 or plus, something's going on. BRCA, that is BRCA acronym for breast cancer gene that you might have. There are other acronyms for when you do this test. I guess it's for like ovarian, prostate, lymphoma. There's different cancers that you could possibly have in your gene. I highly recommend having this done just so you know. It's really not, it cost me $200. Like, just have it done. At least you know, like, what to screen for in the future. I don't know. That's just me. If you don't want to know, you don't want to know. I hate to be blindsided by something where they're like, you know what? You got 6 months to live because you didn't do shit. And you didn't do your due diligence about your health. I mean, I like my red wine, but I'm healthy as hell. And I'm going down swinging. Actually, I'm not going down. How about that? Lastly, it is a slow grower. It's a 1.3 centimeters. Once again, when they did the MRI, I did not have anything in my left, nothing in my sternum, nothing in my core. It was very isolated. Cancer in my breast milk duct. That's where it started, in deep tissue. Another thing, if you have dense breast tissue, there's A, B, C, D. C, D, very dense. A, B, fatty, whatever. Even if you have breast implants, I would suggest that you have ultrasounds because the breast implant will definitely mask some of that tissue. Even if you're like a very lean woman, if you're a lean, fit woman naturally, and then you had breast implants, that tissue underneath the breast implant is still going to be dense. It's going to be hard for detection of cancer through an MRI. And one of the nurses or radiology techs, actually, when I had the MRI, she was great. And actually, her daughter worked at Sandbar. She was great. She told me that you're better off just having the doctor write you an MRI if you are a CD density. Instead of going through the radiation, she said that it's such a terrible process for you as a woman to be exposed to this amount of radiation through MRIs. I'm sorry, I misspoke. Through mammograms. Mammograms are high radiation. MRIs and ultrasounds are low radiation. She said there's a way for your doctor to write it so that your insurance will cover it. Okay? So from now on, she told me every 6 months, moving forward, regardless of whatever I decide to do, I am doing not a mammogram, I'm going to do an MRI, then I'm going to do an ultrasound every 6 months, then an MRI, then an ultrasound every 6 months. And I'm going to have my doctor, and she said, you can tell your doctor how to write it based on your breast density. Because if you're already diagnosed with the denser breast, they have to approve it, and he can write it that way. All right, so these are some of the things that I wanted to talk about today. So on the 16th of September is going to be my consultation with my surgeon. My BRCA score should be back by then. I'll know if I have the gene or not. This is going to play a big part in that decision making. Hopefully, I don't have to have chemotherapy. I took 2 videos and I erased them because I started crying through both of them because my mom had chemo and she lost her hair. It was a whole thing, and it deflated her as a woman. Can you imagine just fucking losing your hair and looking like she described a baby bird or a monkey? She's kept saying I look like a monkey. I don't wish it on anybody. I saw her go through it. I can't even talk through it for the 3rd time. But anyways, I think my scenario is going to be endocrinology, not chemotherapy, and maybe a little bit of radiation. By the way, radiation does not make you lose your hair. It is chemotherapy. There are chemotherapies that make you lose your hair, and there are chemotherapies that don't make you lose your hair. The chemotherapies that make you lose your hair are usually the ones where they port you and you are HER positive and a ER negative, which is the aggressive cancers, which my mom had, the very aggressive squamous cell rectal melanoma. Look it up. There's like 1 in 200,000 people that get it, maybe. It might even be less than that. I don't know. I have my theories. I don't want to go there. I'm going to say COVID shot. But that's just what I thought. That's what I think, because I've done a lot of research. So, anyways, best wishes to all of you. Happy Sunday. We are losing daylight by the minute. We're about to sunset behind 8 p.m. I think last night's sunset was like 7:58. What? Going into Christmas mode. I'm going to have to start Hobby Lobby. Can't wait till the Christmas ornaments start going on sale because I got some ideas. Great ideas. Anyways, y'all have a great evening, and whatever you do, be a badass.